That's
Yeah,
the big one right
I feel
there.
it.
Let this ear be nice and relaxed. Excellent.
Oh, good one.
Now this one's a little different. We're actually going to pull this side from the front. The last one's a bit more of a sniper shot to get that specific vertebrae. And this one we're going to help a couple of them regain the curve.
Ooh, good one, Doctor. Wow.
Good. Now let's look all the way right. Excellent. All the way left. Wonderful. All right, model citizen, good to go.
Thank you. Oh my gosh, thank you. Wow. This one was so different, the forward one. I don't think
Yes.
we've done it before. Wow. It was
Yeah,
so
that
good.
was a different one. That's a pull. So it's still getting that side, but
Oh, everything felt really good.
yeah.
Thank you,
that's one of my
guys.
favorites.
Thank you, doctor.
Thank you.